Change an adult diaper at home without an assistant. Let me first remove my mask. How to change an adult diaper without an assistant at home. Follow me and I'll show you how. The first thing you do is to wash your hands to prevent bacteria. I don't have a toilet at home, so I'm going to use these two baskets. One to wash and one to rinse. Let me put my mask away. So first, you make your hands wet, and then you take the soap and you wash it very well. The reason why you need to wash your hands very well is because you need to prevent bacteria and infection. To wash it off very well. So I'm going to put this one down and rinse it in another basket with clean water to make sure all the bacteria are washed off. I'm going to put it down and take a very dry towel to dry my hands off very well so that I can wear my protective gloves. So when your hands is wet, your gloves may not sit well. So make sure your hands are very dry. So I'm done drying my hands. I have two pair of gloves. One when I'm changing the diaper, one when I'm putting on a clean diaper. Let me put one down. So I know sometimes it's very difficult to put on gloves because you are in a hurry or you feel lazy, but trust me, it's very important to always wear your gloves. It's to protect yourself first and to protect for the loved one you are caring for or the patient. So you see, sometimes it's extremely difficult to put on these gloves, but trust me, it's very important you take time to put it well on, because you need to wear these gloves and protect yourself. So you need to be a little bit patient. So I'm done putting off my protective gloves. So this is Gina. Gina is going to help me today to show you how to change a diaper at home without an assistant. And I'm Mariana, the carer. So the first thing you do when you come to your loved one or the patient, remove the blanket or anything standing in your way. So what we do here is that we'll remove the blanket from Gina to make sure nothing is in our way. You fold it to the side, or if you have a table, you can put it aside. So, near Gina, what you do is you remove the tabs of the diaper, you tap it on the diaper there, and the other one. Remember, when you are changing a diaper at home, you might find that the person has passed too much urine, the diaper is full, or the person has passed stools. So it's very important you have all your equipment ready. And remember, changing a diaper at home or anywhere, it's a very difficult task to do. And it's extremely uncomfortable thing to do. You can feel like you want to vomit up or you are not feeling comfortable. But remember, you are doing this for your loved one or the patient you are helping. Because end of the day, you may find yourself in this situation. So you go to the other side. You tape it here. So the reason why you're taping it here is because it's to prevent this from sticking onto the patient or sticking it onto your gloves. So you need to put it back on the diaper. And then you remove the diaper, which, she has passed some stools. So this is an extremely difficult moment, especially when they've passed some stool. But remember, you were once also a baby and it was not comfortable for your mother or father to change you. It's very smelly. So put yourself in their position that now it's your turn to take care of them. So trust me, you need to communicate with them. Be as kind as possible as you can be. So what you do is you use the diaper to roll clean hair. You remove the stool by using the diaper by rolling it off downwards. Never clean from back to front. Always clean from front to back to prevent bacteria or infection. So we clean, we roll it up. Oh, there's so many stools. So you need to use your wet wipes. Do not save on your wet wipes. Use as many as possible as you can. So and then we open it here. And it's extremely difficult to work with glass pad, yeah. So you wipe between the legs. You wipe very well off. And then the wet wipes, you put it inside the diaper. And then you continue cleaning with the diaper as well. And you roll it backwards. You continue rolling it backwards. You take more of your wet wipes. I know while you're busy doing this, you may not even want to communicate to your loved one, the patient. You just want to finish, but continue communicating and telling the patient what you are doing. So you continue cleaning and cleaning and cleaning and cleaning. You put the wet wipe inside the diaper and you roll it downwards, roll it downwards. So once you are done with the front side, to prevent the patient from falling, we need to use a pillow. Use any pillow you have at home to put it on your side to prevent her to hurt herself. If the patient or your loved one has leg issue or leg problem or has broken their knee, do not bend them. Just take their legs straight and you roll them over. In the diaper, you put it downwards, backwards, and then straight. You roll them towards your side. So it gives you space to see whatever is happening behind your patient or your loved one. You continue to roll your diaper downwards. You take more wet wipes, put it close to you so that it's easy to reach. And then you continue to clean. Do not clean from back to front. It's front to back to prevent bacteria and infection. Continue to clean, make sure everything is off. You put the wet wipe inside the diaper. You continue to roll the diaper up. And then you pull it out from the patient. So just pull the patient a bit towards you so that there's enough space for you to pull out your diaper. I know it can be a very difficult process. You roll it easily and you roll your diaper up to prevent the stools from coming out of the diaper when you are discussing it. You put the tips on the diaper. You make sure everything is in there. There you go. Immediately once you are done doing this, discuss it into the trash bin. Okay, what I do normally is to prevent bacteria or any infection coming to my patient or loved one. I still use a wet cloth with a little bit of soap to wipe her off gentle. This prevents bacteria or any infection to my patient. So you continue to leave her on the side and there's a pillow supporting her. So I have these two clothes, one to dry off and one to wash it. So I use this other basket since I don't have a toilet here. I put on a little bit of soap. This also kills the smell, the stool smell. So I go to my patient. I wipe nicely off my loved one. You need to act as normal as possible. Act like you cleaning your loved one at home. It's not disturbing you in any way, or you don't feel like vomiting, because they can sense that. Once they are comfortable, you as well need to be comfortable, because it's best for you and for your loved one that you are doing it for. So continue cleaning. You just lift up this up like a little bit. You clean inside very well. Very well. Okay? Things off. We rinse it out. You see the smell is also a little bit, it's off. And then you come again, you clean off. And then we use the dry cloth to gently dry hair nice off. It's very good you don't leave your loved one or patient very wet. It makes them feel uncomfortable, very uncomfortable. So dry them very well between the legs. You dry them. put this away. Okay, what we'll do now is that we'll put on a new diaper, a clean one.